The information in this section doesn't provide you with comprehensive training in first aid, CPR, or emergency response. It is intended to provide only basic awareness of what to do in an emergency. If there has been an accident or disaster that may have caused injuries, your first priority is to assess and secure the accident scene and prevent anyone else, especially you, from getting hurt. Before treating any casualties, stop and try to work out what actually happened. Assess the forces involved and think about the injuries they could have caused. Anyone who may have a broken bone or a neck, head, or spine injury must be treated as a trauma victim and must not be moved. Think about the dangers the accident presents and how you can keep yourself and others safe. First aid to treat minor injuries is a good thing to be aware of, but there may be risk involved when providing first aid. Your work area should have a first aid kit to deal with injuries such as sprains, minor cuts, insect bites, and burns. Only provide first aid that you feel confident you can perform successfully and if you're trained to do so. Wear gloves whenever you provide someone with first aid. Make sure you know where the first aid kits are located in your facility, and wash your hands both before and after performing first aid. If you are unable to provide adequate first aid, call for medical assistance. For any severe emergencies or injuries, call 911 right away. While you'll still need training to be certified for most first aid activities, having some knowledge of how to treat minor injuries is always helpful. If you'd like more information on how to treat minor injuries, click the link on your screen. Workplace medical emergencies vary greatly depending on the disaster, type of job, and the work site. Serious injuries caused by accidents such as burns or broken bones may be obvious, but medical emergencies can also take the form of illnesses such as choking, allergic reactions, heart attack, stroke, seizure, or diabetic reactions. Some medical emergencies may be difficult to interpret. Cause of chest pain, for example, can vary from minor problems such as indigestion or stress to serious medical emergencies such as a heart attack or pulmonary embolism. If you notice or suspect a medical emergency, dial 911 and/or your company's emergency response number immediately. It's always better to call for assistance and not need it than to risk additional injury or death due to a delay. Choking occurs when a foreign object becomes lodged in the throat or windpipe, blocking the flow of air. In adults, a piece of food often is the culprit. Small children can inhale small objects, which obstruct the windpipe. Because choking cuts off oxygen to the brain, administer first aid as soon as possible. Here are some indicators that someone is choking. Hands clutched to the throat, inability to talk, difficulty breathing, noisy breathing, inability to cough forcefully, skin, lips, and nails turning blue or dusky, or loss of consciousness. When you encounter a conscious choking victim who is unable to cough, speak, or breathe, the first thing you should do is send someone to call 911. If the victim is choking, lean the person forward and give 5 back blows with the heel of your hand in between their shoulder blades. If back blows haven't cleared the airway, perform a series of abdominal thrusts, commonly referred to as the Heimlich maneuver. Stand behind the person and wrap your arms around the waist. Tip the person forward slightly. Make a fist with one hand, position it slightly above the person's navel. Grasp the fist with the other hand and give 5 quick abdominal thrusts, and repeat until the blockage is dislodged. If you're the only rescuer, perform the back blows and abdominal thrusts before calling 911.